Coming up next is the Dr. Kim Taylor Show. Here's your chance to talk about what matters to you. Although you'll receive helpful advice from Dr. Kim, remember this is not to be construed as any form of psychotherapy, diagnosis or treatment, and cannot replace a therapeutic relationship with a mental health professional. You can reach Dr. Kim by calling 564-1290 or 866-564-1290. You can also listen live on the internet at drkimtaylorshow.com. Now, here's Dr. Kim.
Welcome to our Thursday afternoon program. I'm really glad to be here, and it's a beautiful day in Santa Barbara today. So I'm hoping that at this point, that by listening to this program, that you feel that you're more comfortable to be able to ask questions, and that you actually find this a place that you can tune in each week and learn about issues that face all of us at different points in our lives. Whether we're talking about relationships, families, parenting issues, addictions, or just discovering the obstacles that keep getting in our way, we talk about here whatever's on your mind, and then how to create the kind of life that you would like to live in order to feel happy and fulfilled. Now, at some point in your life, you may also feel that you need to go into therapy. Maybe because you're feeling overwhelmed by your problems, or that nothing that you have done in the past seems to be helping. Or maybe it's that whatever you're doing right now is starting to jeopardize your own success, and people have started to notice and even said something to you. So whatever it is, it might be time to get into therapy. And I've said this before. I think that some of the healthiest people are the ones who come into therapy, because there's just a part of them that knows that they're struggling and that they could be so much better if they just had a little bit of help and guidance. And this is what a good therapist can help you with. They can untangle any kind of confused feelings you have, or they can help you to see the obstacles that perhaps are getting in your way, and even the patterns that you are recreating that don't lead to any kind of success in your life. So all of therapy can really help you to be less afraid of rejection, and then more willing to take the risks to be able to reach your goals. And I think therapy should be a part of the everyday experience of everyone in this modern world, that there shouldn't be any guilt or any shame around it, because done well, therapy really does help promote personal self-growth. And this improves relationships, and it reduces a whole lot of emotional suffering. So whatever the reason that you might have to enter into therapy, just know it does take courage to go to therapy, and it takes a real dedication to be able to see it through. But here's the main questions that I always hear. One of them is, how do I find a therapist? And furthermore, what kind of therapist should I go to? A lot of people don't know what are the qualifications that I should look for. All of this can be very confusing to really know what the difference is between a psychiatrist, a psychologist, and a marriage family therapist. Or even, let's add in here, a social worker or a life coach. So with all this in mind, I have two guests that are going to be joining me today to kind of share in the conversation and talk about the differences between these experts and how you can best choose who will be right for you. My first guest is a colleague of mine. He's a psychologist. His name is Gil Reyes, and he is the current president of the Santa Barbara County Psychological Association. And also psychologist Lauren Guy, who is the past president of the Santa Barbara County Psychological Association. So they are both here to help me talk to you about any questions that you might have. So if you have any thoughts or comments, by all means, give us a call. Phone number is 805-564-1290, or you can email me at drkim@drkimtaylorshow.com. All right, so switching gears just for a bit, they are going to be with me, but right after the break. I'm just going to answer a couple of the emails that have come in. The first email is from Katie. She says, I'm a 14-year-old girl. I have to say that I've been bullied since as far back as I can remember. Nothing I do seems to make anyone like me, and I just feel like nothing will change. I have become mostly a loner. I know that someday things will get better, but I just wish my parents would let me leave school and study on my own. I feel that I would do better and have more ability to focus on what I like and not live in fear that I was going to be embarrassed by the end of the day. Any suggestions on what I can do? Well, first off, Katie, thank you for reaching out and that you sent this email to me. And I'm actually going to encourage you to also reach out and talk to others. And here's why. If you've experienced bullying, I want you to know that you're not alone. There are a lot of people who are out there just like you. And there are people who can help because there are some actions that you can take to try and make this better. So let's be clear. Bullying is when someone or a group starts to make someone else feel hurt or afraid or intimidated or embarrassed. And they do it repeatedly. And this can either be physical, verbal, or emotional, but it doesn't really matter because guess what? It all hurts. So what I want to say to you is that, Katie, it's not your fault. And you don't have to deal with this on your own. And even though that you say that you've tried to talk to your parents, I think you need to talk to them more. And you need to be able to have your parents also talk to your school. Because the good news is today more and more schools are taking this very seriously. And they're trying to nip it in the bud. So in the moment that it's going on with you, just try and walk away and don't get into a fight with them. But afterwards, definitely let the adults know so that they can step in to handle it. And then what I would tell you is that you need to find a friend or a support group, somewhere that you can really express your feelings and to share with others who have also experienced this about what it feels like and what it's like for you to go through this. You want to be able to kind of process this and not to let other people's bad behavior really dictate how you feel about yourself. And then also, I had a guest on my show, and she wrote a book, and she is just like you. Her name is Asia Mayrock. Her last name is Mayrock, and she wrote a book called The Survival Guide to Bullying. And it's written by a kid for a kid. And she really does find the light at the end of the tunnel. And she talks about how to survive this. And I think it would be really good for you to get her book and to start to read that too. So I wish you lots of luck with that. The next one is from Tony. I am the wife of a recovering sex addict, and we are trying to recover. I say we because I feel like it is a process for the two of us. I guess my question is, can the trust ever really be rebuilt? It has been 9 months since a relapse. He has relapsed twice with small things, but it seems the therapist keeps wanting me to try harder. But shouldn't my husband be the one trying harder to gain my trust back and not just expect that I should trust him now and stop worrying? Okay, Tony, first off, it is very hard to repair any relationship when the trust has been broken. And for most addicts, they will have done a lot of lying and covering up of all of their behaviors in the past. And so the partner can end up feeling very betrayed. And really, it makes it very hard for them to be able to trust again. What I want to tell you is this process can take a very long time. And it's going to take a while for you to be able to rebuild, even if the recovering addict is working hard without any relapses. So what's really important in order to rebuild is that the person who is recovering, they must be willing to really start over and build a new foundation of trust. And this means is that they have to be rigorously honest about everything and open to questions and any concerns from their partners. But what I think you need to also hear is that the work that needs to be done by both partners in this marriage. That in order to be able to rebuild it, both of you need to look at yourselves. And I think maybe this is what your therapist is probably speaking to. That the partner who is betrayed, you have to be able to commit to your own healing. You have to start to challenge who you are in this relationship as a couple. And then you need to be willing over time to grow beyond your feelings of anger and betrayal and to find a way to work together with your husband towards trusting again. So what I would say is with the help of a therapist who's really trained in sex addiction and this kind of recovery, that you should be able to see it kind of as a team effort to be able to build a much better and stronger relationship with your husband. So I'm going to take a quick break right now. I will be right back with my guests. I'm Dr. Kim Taylor, and you're listening to KZSB AM 1290.
You are listening to Dr. Kim Taylor on KZSB AM 1290.
We are talking about how to find and choose a therapist who's right for you, and what are the differences between a psychiatrist, a psychologist, a marriage family therapist, and perhaps even a life coach. My guests are both psychologists. Dr. Gil Reyes is here with me, and he is the president of the Santa Barbara Psychological Association. And Dr. Lauren Guy is going to be joining us by phone in a few moments here, and she's the past president of the Santa Barbara County Psychological Association. So, Gil, welcome to the program.
Oh, thank you for having me.
Let's start out with you really telling us, why did you choose to become a psychologist?
Oh, yes, thank you. It goes back to when I was very young. I was really interested in how we become who we are. And I saw the differences between my many friends and I thought, well, we all turn out so differently. Well, what's going on with us? And why do we sometimes do things that we have a very difficult time explaining? We spend a lot of time explaining ourselves to others and even to ourselves. And so I was just endlessly curious about it. And then I was a psychology major at University of California, Santa Barbara. And it got near graduation, and I realized I wanted to go on and get an advanced degree, but I really wasn't sure what area of psychology, or should it be psychology, should it be psychiatry, some other field? Do I really want to help people? And so I did some work with folks at a halfway house with mental illnesses, and the feedback that I got from my supervisors was that I was good at it. I took a look at clinical psychology, and it was like being a kid in a candy store. Mm-hmm. Because I was interested in the brain, I was interested in social relationships, I was interested in development from childhood through the lifespan, and cognition and emotion. And clinical psychologists, it turned out, studied all of those things, not just one or two. So it seemed the right field for me.
And through that process, you now have become the president of the Santa Barbara County Psychological Association. So tell us what that is and actually how that helps its members, but more specifically, how it helps the community.
Well, when I first moved to town, I didn't join the association right away. I wasn't very aware of it as an entity. And then when the disasters were happening, the fires, a few years back, I went out to volunteer to provide some disaster mental health, and I kept running into members of the Santa Barbara County Psychological Association. And they were doing really great work, and they were highly competent and very personable, and I really enjoyed them. And so they issued me an invitation and said, why don't you start coming to some of our meetings and see if you want to join? And I did, and fast forward, this year I'm president.
Part of what people can do is that they can certainly go to the website of the Santa Barbara County Psychological Association, and that they can find a therapist through that. But prior to setting that all up, let's first talk about what are the differences, because this is a question that I get asked all the time. That it is true that in nearly every state that therapists do need to be licensed, but we need to talk a little bit about what are the differences between the different degrees. Mm-hmm. So can you start out by explaining a little bit about what it is in the process and what kind of degree that a psychologist gets?
Okay. Well, starting with the really broad concept of a psychotherapist, we do come from a variety of traditions, and that includes what type of education we got. And when it comes to a psychologist, what we have in common with each other that distinguishes us is that we study the subject of psychology. Now that seems like a no-brainer, but not everybody does that. For instance, a psychiatrist studies medicine first and then goes into a psychiatric residency. And so they are first and foremost a physician who then specializes in working with human problems of the nature that are similar to what we work with. However, we studied psychology first. We built a really strong foundation in understanding normal development and also understanding how it sometimes goes more difficultly for people, and how to work with that very effectively to help people start feeling much higher functioning again, and even happier, healthier, and more satisfied with their lives and their relationships. What I would add to that is that we also, and this was a surprise to me, we had to study subjects like statistics, research methodology, scholarly writing, things like that. And I came to understand what a benefit that has, because I think very scientifically, most of us, many of us, but we also know how to research a question. And you can't rest on your laurels. You can't just graduate from your degree program and then just keep practicing whatever it is you learned in school for the rest of your life. Things change. New problems crop up, and you've got to know how to do research that is going to provide answers that will really help your client.
So the only ones who are psychologists are those that have a Ph.D. or a Psy.D. after their name. And this does denote a higher education, perhaps as a base level, in the number of years that they're usually learning this, correct?
Yes, it means that they've reached the pinnacle of education in psychology, because there is absolutely no higher degree that can be achieved than the Ph.D. or the Psy.D. Beyond that, it's just learning more and more on top of that. But that is the pinnacle.
Okay, and with the Ph.D., it is a little bit more research. And since 1968, the Psy.D., which is actually what I have, I think you have the Ph.D., but for mine, it was more practice in the clinical aspect of it, that we had more hours that we had to put in as far as the face-to-face and actually doing a counseling. So that's the difference between the two, is one is more focused on some of the research, one is more focused on the clinical aspect of doing psychotherapy. You need to see them as kind of like the general practitioners of mental health, that they can look at mental health in a way that is kind of a broad spectrum of research plus clinical practice. Right now we have Dr. Lauren Guy on the phone. She is going to be joining us. Lauren, are you there on the phone?
Yes, I'm here. Thank you so much for having me on today.
Yes, we are talking about what is the difference between psychologists and marriage and family therapists and licensed clinical social workers. And so we've just started out with psychologists. Is there anything that you would add to that?
Let's see. I'm kind of jumping in the middle there, but I think you guys did a really nice job of differentiating between psychologists and the extra training and the extra skill sets that we have due to our emphasis in clinical and research background.
Okay, and you chose to get your doctorate degree also, correct?
Yes, I also did the Psy.D., which, as you mentioned, has a little extra emphasis in the clinical practice, the face-to-face psychology.
So let's move on a little bit and talk about the master's degree, or one that would have what's called a marriage family therapist. And there are other different degrees within that. But let's talk a little bit about that level. Why would someone choose a marriage and family therapist?
Well, I think that if they were having a problem in their marriage or a family problem, they would see that title and would likely think, well, this is someone who specializes in marriages and families. And so they would go to that person. just as if they saw someone in a hospital and it said pediatrics, they would take their child there because that was a specialist. I think, however, they would be overinterpreting what marriage and family therapist title means. That is certainly what they're trained in, but they're not the only ones trained in that. I know many psychologists who are trained in working with couples and in doing very advanced forms of family therapy. I also know child clinical psychologists. I was trained in a child and adult blended program who take a lot of courses in child development and are very adept at that. So I think one of the challenges for someone looking for a therapist is to really be able to know more than a simple job title.
Lauren, is there something you would add to that also?
Yeah, I think that on the flip side of that, we also need to credit our master's level therapists, whether they're marriage and family therapists or licensed clinical social workers, that they too can provide services outside of marriage and family or relationship or case management, that they can also help with other clinical issues such as mood disorders or even higher disorders on the spectrum. But again, the defining factor is that their training and their exposure to practice tends to be less than psychologists. And so it's just good to really be doing your research about who that person is and what their experience has been in their clinical practice.
Okay, because the average length for a doctorate program, which again would be the Ph.D. or the Psy.D., is after your undergraduate work, which is 4 years, then you go on and do another 5 to 6 years of a study. Whereas in a master's program, they do the undergraduate work, which is 4 years, and after that they do 2 more years. And again, this is not to say that people don't go on and do different learning and take different training in a lot of different areas, but this is the minimum of what each discipline is required to do. Mm-hmm. So what I want to say with a master's level, just so you know what all the letters are, is that a master's level has either an MA or an MS or an MFT after their name also. There are a few others that go along with that, but those are the main ones, correct? Mm-hmm. I'm not missing one here. Okay, and then a licensed clinical social worker, or what is the title, LCSW. Do you want to speak to that, Gil?
Well, I've worked with many social workers from the time that I was a graduate student when I was working on my master's degree, the degree we get before we get our doctorate, at least in the kind of program I was in. And the social workers are excellent at working with people who need maybe some case management in addition to some psychotherapy. I did see them dealing with a lot of issues that had to do with family problems. Mm-hmm. So, for instance, I would do some work at Child Protective Services, and that was mostly social workers. And I would do work with domestic violence, and much of that work in systems such as Department of Social Services was mostly populated with folks with social work degrees.
Okay. We need to take a quick break, but we're going to come back, and one of the biggest questions asked is, what is the difference between a psychiatrist and a psychologist? And we really want to clear that one up. So I'll be right back after the break with my two guests.
You are listening to Dr. Kim Taylor on KZSB AM 1290.
If you are just joining us, my guests are Dr. Gil Reyes and Dr. Lauren Guy, and we are talking about the differences between psychiatrists and psychologists at this point. So this is a question that I get often, and people get it confused. They don't quite know which one to go to. So what is it that you say to perhaps your clients about just explaining what it is that they need to know about the difference between these two, Gil?
Well, yes, first off, the psychiatrist is an MD. This is a person who's a physician, just like your family practitioner. And what they did when they got to a certain point where they had to declare a specialty, they declared psychiatry. And so when they did their residency, then they focused on psychiatric issues, things like schizophrenia, mood disorders, other such things. They are also prescribers of medication. And so when someone has a problem where they think that they're going to need to be evaluated for medication, a psychiatrist is going to be the person, at least in this state and most states, who is going to be able to prescribe for them. Now, of course, every answer opens up all kinds of other complications like, oh, are they the only ones who can do that? No, your primary care physician can also prescribe. But the expertise to know how to manage medication for a person, particularly with a serious mental illness, would definitely be sent to a psychiatrist.
Okay, because they day in and day out are working with the psychotropic drugs, and they know a lot of the nuances because they are specialized in that. Now, do psychiatrists do therapy?
Psychiatrists do therapy, so they are folks who can do a whole lot of different things. If they're just doing a medication appointment, it's typically a 15-minute consult on how you're doing, and it's really focused mostly on how your medications are affecting you both positively and negatively, which are, of course, known as side effects. If they do psychotherapy, then that's good, too. They've been trained in doing that. They vary in their theoretical orientation, as it's called, meaning from what perspective are they doing psychotherapy. But in my experience, the lion's share, well over 50%, are psychoanalytically oriented as well.
Really, for the most part, a lot of them only do a medication, a management, and then they refer to a therapist, whether it's a psychologist or someone else, to do the therapy part of it. And that often happens too, because psychologists do not prescribe, but they do work with psychiatrists who do prescribed. And by the way, the letters after their name are definitely MD, because they are a medical doctor who has specialized in this particular field.
Yes, and they do their fee structure is very high compared to other folks who do psychotherapy. So I'm sure there's probably more than one reason why a psychiatrist would refer a patient to someone else for the psychotherapy. But one clear-cut reason is because it's very expensive to see a psychiatrist for more than a 15-minute medication consultation.
Lauren, do you have something to add to that also?
I think I'd just like to echo what you both have said, in that historically psychiatrists were a little more able to provide the psychotherapy aspect, but with the introduction and changes in managed care, it really has to be a team of a psychologist or another therapist partnering with a psychiatrist in this day and age to make it accessible for most patients and clients.
And I think one of the things that I would add also is that because they are specialized, that if you need a medication, it's really very wise to go to someone like this as opposed to just a general doctor, is because they can really help to decrease whatever side effects might come up and decrease whatever symptoms that you're having, because they do not treat a diagnosis. They treat symptoms. And so they're really good at the nuances of that and really being able to discern, given the kind of symptoms you have, what it is that you might need, or the combination, or what might need to change within whatever medication that you're taking to make sure that you're getting the best possible result. So it is very important that they have an MD first, that they understand how the body works and understand all of the functions of the body in that way. Now, there are also, I understand now, some more nurse practitioners that are also leaning toward the psychiatric, psychotropic drugs that are also starting to prescribe. So that is also out there, but that's a newer process that's happening, I believe, too.
Mm-hmm. There are also psychologists who are seeking prescription privileges in some parts of the country, and there have been laws passed that are allowing psychologists to attain prescription privileges, but the bar is very high, just as it is for physicians and nurse practitioners, and well, it should be, because it's something you don't want to get wrong.
What would you say to people out there who are trying to decide, do I go to a psychiatrist, marriage and family? Is there kind of a rule of thumb or something that you can use as a guiding force?
Well, I think it's only honest for me to say that I'm biased by the fact that I'm a psychologist. That said, I tend to see if a person has a really severe problem and it's not what you might call mostly biological, then I think they're well off seeing a psychologist. If it is strongly biological, then I think they need to be involved with the right kind of physician. Typically, that would be a psychiatrist, but in some situations where the brain is affected, it's a neurologist. There are also neuropsychologists who can be very helpful with things that have to do with the brain and its functioning. So it does pay to get a little bit of education around the specialties. However, if their problems are of a sort of everyday life sort of thing, not very intense, not requiring extremely high levels of expertise, then I think they're safe in seeing a counselor. Sometimes they need to see a career counselor, somebody who can help them get on track to change from one kind of job to another or increase their satisfaction in their occupation. Maybe it's a family issue, the marriage isn't going very well. They think, well, that marriage and family therapist comes highly recommended by friends of mine. She has saved their marriage. That's a good direction to go in as well. So they have many choices.
Lauren, what do you feel that you can share just as far as what should people be looking for as far as the minimum qualifications in someone that they're trying to find?
We really want to make sure that the therapist or psychologist or psychiatrist that you choose does have the degree that we've been mentioning. And it's also important to think about, years in practice and also experience. But I think more importantly, to be asking as you inquire with these health professionals what their philosophy is, what their orientation is, and what they're doing to continue to educate themselves and stay current about what training is out there, what education there is, and to really communicate with these possible providers what you're looking for exactly to change in your life, to see how that provider would tell you that they can help you in that process.
And you definitely want to make sure that they are licensed in the state, that they
that's correct.
And that they have at least a master's degree, and that you want to really try to avoid any counselor who has little or no training or who doesn't have a license that they have to adhere to with the certain ethics and principles that they need to follow. So I think the next one is, how do people find a good psychologist or therapist?
Well, from what I hear from people, they will say to me, I started looking in the phone book, and of course we're moving away from phone books now, though I still know a lot of people who use them. It surprises me when they tell me that. Many people will look on the internet. They will ask a friend, have you ever been in therapy? Do you know a good therapist? What's she like? What's he like? And so it can happen in a number of ways. Also, sometimes they come to it through another relationship. So perhaps they're seeing their primary care physician and they're saying, I've just really been down lately, and the primary care physician starts to think, I think there's some depression here. Let me recommend you to a therapist. And so sometimes it's through a referral source. Sometimes people go into crisis. And they're very upset, sometimes disturbed, disoriented, and they need emergency care. And so they'll be seen maybe by a hospital or the county department of mental health, and then they'll get referred to a therapist for longer-term care once they're stabilized. So there are many routes to making that decision. Under the best of circumstances, they're well informed, they've done their research, and they have maybe talked around to some people and seen what they think of that particular provider.
My guests are both psychologists. Dr. Gil Reyes is the president of the Santa Barbara County Psychological Association, and Dr. Lauren Guy is the past president of the Santa Barbara Psychological Association. We are going to take a short break, and we'll be right back after this.
You are listening to Dr. Kim Taylor on KZSB AM 1290.
Today we are talking about how to choose a therapist and also discussing the differences between psychiatrists, psychologists, and other mental health professionals. And joining me is Dr. Gil Reyes and Dr. Lauren Guy, both from the Santa Barbara County Psychological Association. Lauren, tell us a little bit about how people can find help by going to the association's website.
Yes, the Santa Barbara County Psychological Association has an easy, accessible website, and when I talk with many of my clients about their process of actually finding a therapist and then ending up seeing me, it really seems like 80 to 90% of my clients are Googling on the internet, trying to research people, and what our association does is provide a very nice way to get to know a little bit about the psychologist there. Our psychologists seem to be very open in sharing with a public profile about their education, their history, their specialties, their approach to therapy. And if you go to www.sbcpa.org, it's pretty simple, you can easily navigate through our Find a Therapist function, and it will pull up pages of both photos and biographies for many of our therapists. And you're able to actually select different criteria, whether you're looking for someone who is contracted with your particular insurance panel, if you're looking for someone who is in your certain geographical area. There are many factors to choose to search from, and it really helps narrow it down to a therapist who would be appropriate for you, and it gives you a base to go from when you start making those calls and start reaching out.
Okay, and the part that I really like about it is that they can really go and see the individual profile about what the therapist wrote, as well as to go onto their website so that you can kind of get a feel about who they are, what they do, and see if it's somebody that you definitely feel like you can perhaps make that first phone call. Because you should be able to go and make a phone call and set up a time, but you want to know that you want to go in and meet that person and talk to that person and then decide whether that person is right for you. Gil, I think the question that we're probably going to end on is, when should someone really consider therapy?
Well, I think as soon as a person begins to even have the idea pop into their head, they should really first think about not waiting too long. Don't wait until you're in really terrible shape and you're in the psychological equivalent of the emergency room. We often see patients, particularly our clients, coming in, particularly when there are marital problems, for instance, when their marriage is on life support, and we're expected to resuscitate it when, had they come in a year, 2 years earlier, the prognosis would have been a lot better. There are reasons why people don't come in. There's a lot of stigma around seeking mental health. Maybe it means I'm weak. We give it a moral sense of weakness, which is completely wrong. It's not your fault, and it's not your flaw. And instead, what we need to understand is that this is a health issue, just like any other health issue you have. For too long, we've separated the brain from the rest of the body and the mind from the rest of the self. This is about your whole body and your whole self. It's not just in your head. It's all involved. And we are there to help you non-judgmentally. We don't see you as having a flaw. We see you as having the courage to get the help you need.
What I do know is that people can reach the both of you by going to the Santa Barbara Psychological Association website, which is sbcpa.org, and they can just put in your name and it will come up with a profile. How should people know if therapy is working?
That's pretty hard to know because a lot of times they think they're going to get better really quickly, and sometimes it feels worse before it feels better because now you're sort of breaking at some of your defenses and creating new coping abilities. And so I don't mean to say no pain, no gain, but it takes a little bit of work.
And Lauren, it sounds by your laugh that that's exactly how you feel too.
Yes, exactly. And I think some clients are surprised by that, but that, to not be discouraged in that process, but to echo Gil, that there's courage in that. And, sometimes depending on a therapist structure, there may be goals that are set. And so, oftentimes you can measure progress by increased self-understanding, or you can see it more tangibly in the reduction of certain behaviors or the improvement of specific symptoms. So periodically, you and your therapist should be checking in to make sure that you're moving in the direction you had decided to go.
Thank you, Dr. Gil Reyes, and thank you, Dr. Lauren Guy, for being here.
Thank you very much.
And I will put all of their info on my website also. I'll be right back with some closing comments.
You are listening to Dr. Kim Taylor on KZSB AM 1290.
There are a few things that are very important when you're trying to work with a therapist. It's really important that your therapist has a master's or a doctorate, a degree in mental health field. So this would include the Ph.D., the Psy.D., the MA, the MS, the MFTT or MFT, or the MD. And you want to know that they have been supervised in clinical experience, where this is really where they start to learn their trade. And to be quite honest, it's where you earn your stripes. And then they need to have a license with an authority to which they will be accountable. And I would also add to all of this is that I think that they really need to have been in therapy themselves so that they've worked out their own stuff and they're not going to kind of bring that within the room. And then the therapist needs to be someone that is open and honest with you, and you need to feel that you can be open and honest with them. They're not there to be your friend, but neither are they there to judge you. They're really there to be present, to really help you deal with your pain so that you can move forward in your own life. And then the last thing I'd tell you is trust your gut. Set up a time, go in and meet them, but trust your gut. And you well know within that first session whether this is somebody that you're going to be able to work with. So that's my program. I will be back here again next week, next Thursday afternoon at 5. If you miss any part of this show, you can certainly listen to the rebroadcast Thursday evenings at 10 and Sunday mornings at 9. You can also find my past shows on iTunes and YouTube. So I want to thank you for being here, and I will see you next week. Until then, remember, nobody else has to change in order for you to feel better.